Everybody, my name is Amber. I am joining Joyce on our What the Vet podcast. A little bit, I guess we're doing intros today, so a little bit about me. I started in veterinary medicine at a very young age. My mom was a technician my entire life, and I told her, more or less made the mistake of telling her when I was 9 years old that I wanted to do what she does. So she brought me to work. First day, I call it veterinary boot camp now, was what she put me through. My first day, I was playing with a Frenchie in the lobby of the hospital. Never forget him. His name was Ollie, black brindle, sweetest dog ever. 5 minutes later, I was in an exam room with my mom, the doctor, the dog, and the owners, and he was euthanized. I had no idea what was happening. Wasn't prepped for anything. So, being my first day, to ease me into it, I had to bag and tag the dog and carry him downstairs to what was like a dungeness basement and put him in a freezer. And when I went to put him in the freezer, there was one of those, those trays back in the day, like when you were in high school and you did the frog dissections.
I was thinking you're going with like a morgue, like pulling out the tray.
It was like those where you put a frog to do, like you pen the frog to do the dissections in high school in like bio class or whatever. Okay, well, rather than a frog, it was a pyometra uterus. I was 9. And I come upstairs. My mom said I was green. She was like, what is wrong with you? I said, what? What is that? And it smelled like they had just taken it out, bro. So, anywho, I did not get the warm, fuzzy kitty introduction to vet med. I went straight through boot camp, and here I still am. My hope was to go to vet school. Unfortunately, my senior year, I got into a really bad car accident. Had some pretty nasty head trauma. Had to relearn how to tie my shoes and go back to remedial math and whatnot, and told myself I didn't want to do vet med anymore. Anyway, long story short, I'm here. I haven't left. Yeah. Tried to pursue the whole pre-vet thing again, and for some reason, like chemistry and calculus and all that stuff doesn't compute all that well, I guess because of my accident, but I was shifted to CVT. And then while I was doing the CVT, I got inspired by, may he rest in peace, Mark Opperman, who is a phenomenal practice management consultant. And after I seen him speak quite a few times, I said, that's what I want to do. So I shifted tracks and went into veterinary practice management, of which I very much love the position that I'm in, because not only do I still get to advocate and care for the patients by, setting protocols and standard operating procedures and things like that, but to be able to support the staff who take care of those patients, to be able to be their backbone, to be the person that they lean on to help them through compassion fatigue and burnout and things like that. And to literally be that buffer between, ownership and the staff, or corporate leadership and the staff, just to be that advocate for them, because I remember growing up in the field, I didn't have that. I didn't have somebody to be that buffer between me and what you would call the bigwigs, somebody to advocate for me. I had phenomenal bosses, I get that, but like somebody to step outside of that ownership role or that corporate leadership role to say, hey, you know what, you're a human being too. Like, how can I support you? What can I do for you? I did have one boss who still to this day has my back, and her staff's back, but again, it only goes so far. And then my current boss is phenomenal. Anywho, I've been in veterinary medicine for probably roughly 20 years. I've started in GP. I went into shelter med, did cruelty investigations, set up spay-neuter clinics, helped revamp the shelter in my county, our whole medical department, and I left shelter med to go into another shelter, but at the same time I was working in an emergency specialty facility, and that's when I had the traumatic experience of meeting Joyce, and we'll go into that later. And here we are 5 years later.
I leave a lasting impression. I can't help it.
Exactly. So I went into, I left shelter med, completely dove into emergency medicine, and went into specialty. And even before that, I did emergency medicine and some specialty, but more so it was GP. And like I said, now I manage 2 practices in the Tampa Bay area. I help with one in the Orlando, and I am actually in the midst of getting my captain's license to do offshore fishing charters. That's my retirement plan, and that's actually my self-care to be able to refresh and then go back to work with a clear mind and I guess a clean slate each week. That's me in a nutshell. Like, I grew up in vet med. I eat, sleep, breathe it. I'm always reading articles, taking webinars, going to conferences, and even when I get home at night, when I try to leave my work at home, my mother how was your day? Do you have any fun cases? And I'll end up talking to her for 2.5 hours about everything that happened during the day and how we could have done better, and maybe some tests that the doctors didn't think of. And like, it's just a 2-hour conversation back and forth, which is nice to be able to have that in common with my mom. So it's, it's been a part of my entire life. I mean, I used to be so mad at my mom for missing everything because she was a veterinary technician. She missed school functions and games and Christmas morning and stuff like that because she was at work, and I was upset. And until I got into adulthood, and it's history repeating itself all over because I miss everything because of work. I prioritize work over everything, relationships, family. I mean, I've gotten a lot better about it, but... I was
like, but you're getting better about the boundaries on that.
I'm getting better about the boundaries, but it's not just... And I keep trying to get away from the field, and I know when I eventually do, I'm going to miss it. Mm-hmm. So I'll probably still volunteer for shelters and things like that. It's a lot of people will say, oh my God, this is what I do, not who I am. No, it's literally who I am. It's how I've grown up. It's how everybody sees me. It's how I identify. Like, that's not just what I do. It's a part of me. So, but I decided to get on this podcast with Joyce to talk about the things that don't really get talked about in our field, about some of the things that we have to encounter as staff, as leadership, with our clients, with our patients, with, different laws that come about that impact us. Just things that kind of get swept under the rug that we would like to shed some light on. So that's why I'm here.
Yep. And then I am Joyce. I grew up in Indiana on a 40-acre farm where we had sheep and beef cattle and did all of that. And then all I knew is that I wanted to work with animals. I thought I was going to go more on the equestrian side and do more of that. But then International Business College came to Fort Wayne, Indiana with a vet tech program. So did that. And then I went on a 2-week vacation to Florida to visit my brother. And I had a job a week later at an emergency clinic. So my deep dive in was my first shift was a GDV that had been GDVing for a while, and it didn't go well. And then its neighbor was a dog with HG on top of it, so I had never experienced those smells before, and it was my first overnight shift. So that was my introduction to true vet med world, not just here's a textbook, here's a spay and how a neuter is, and then it was like boom, right into actual emergency care. So then I did strictly emergency for 3-4 years, and then helped out with the ophthalmologists that would come in and work out of the building during the day with their procedures and stuff like that. And then I needed a break from emergency care and thought day practice was the place to go. For me, it wasn't. I lasted 6 months. It was fast paced. That wasn't the problem. I was just very bored. So I went into critical care and was in charge of the ICU there, where they also had cardiologists and neurologists there. And then that's when I went into internal medicine, and that's pretty much where I found my home, was internal medicine. But I fought it for a year, where the doctor that I worked with would just send me random texts, come to the dark side.
Couldn't imagine
Amber.
That one.
Amber knows those texts because she also got them. And it took me a year because I saw just how much they worked compared to what I was doing. And I was like, no. I had a sweet schedule. I worked Tuesday, Wednesday, Thursday, 12-hour shifts and 4-day weekend every week. It was wonderful. And then something happened with her technicians and she needed to fill in. And I never looked back after I went there. But then 3 years now, I went through a mental breakdown where Amber and I worked, and I left veterinary medicine. And just for people listening, you will randomly hear dogs on both ends. You will hear banging. We will occasionally tell them, in no uncertain terms, to shush it. And they're delinquents. My lights are off because my room is very messy and I don't want you to judge me. But you'll see a little bat-shaped thing on my corner. That's just my dog peeking out with her little bat ears. But yeah, I went through a mental breakdown. It took me a full year to get out of that depression, and then a year to kind of rebuild. And then now I feel definitely better than what I was, but it was a journey, and I am still outside of veterinary medicine. I'm going to call myself a glorified receptionist at a human hospital on the progressive care unit. So still fast-paced, heart patients and that, but I can't help but be bossy, and I boss people around. But every now and then I get to actually pull out knowledge that I've learned and being like, I can actually keep up with what you're talking about. But yeah, I still miss veterinary medicine. I'll miss that side. Yes, it's my knowledge base, but I just don't feel like there's a niche for me in it anymore. I don't want to be just a technician. One, my body says no. My knees say thank you for not doing it. My back says thank you for not doing it anymore. And there just isn't a spot for me yet. I was a really good advocate for the team, but when I say Amber is a 10 times better leader, it's just she says no, but she's a practice manager for a reason. I am not. Her and another coworker were called the generals, and then I was the person underneath them, because I'd be like, yeah, what they say.
Yep.
And then I would go into our manager and being like, no, they said no, so we're not going to do it.
Yeah.
You know, that was my...
Well, they'd come to me with something. I'd be like, well, what did Joyce say? She said no. I said, and it stands.
And it stands. You know, I still have a dog. I have a horse. You know, that animals are still a big part in my life. Veterinary medicine, I would like to become a part again, just in a different role. And then here's our podcast in a way that we've been talking about, I think, for 4 years now. And we're gonna do it. Yep. So that is us.
We're gonna do it.
We're gonna do it. We're gonna give it a good solid year, is what we agreed on, to keep going. The big thing is that we want it to be like a big discussion. So like if people have topics they want to bring up, we'll talk about it. If we can find specialists in that area, we're going to bring them on. Gesundheit. If not, we will bring up all the studies that we can to help guide and support all the above. You know, I think it sums up also just how much we love the field still. It may make our soul a little black inside with everything that goes on between the clients and the pets and the management and everything like that. But, you know, we went in it to be a voice for an animal, to be the advocate. Not for the management side, not for the client side, it's for the pet. And I think that gets lost in translation sometimes.
Very much so.
Yeah. And then Amber and I met, what was it, 5 years ago now?
It was November of 2020.
Okay, the fact that she remembers the month and the day.
Uh-huh.
Is
when you are traumatized, you typically remember those dates specifically.
I know it was a Saturday. I knew she was coming in to tour the place and interview because she was also just going to be picking up Saturday shifts. And I was like, cool, sounds good. I knew she came from Shelter Med. I was like, okay. So she came in. The manager at the time is touring the area, and the way it works is like where the hospitalized patients are, there's a closed glass door, and then I don't even know what they called that area anymore. It had like wet tables and exam tables and stuff like that. And then where I was, and so they were coming, he pointed to the area. Amber very bravely walked that way. She opened up the door, and I was on the computer, and I looked at her, and she was like, hey, I'm Amber, like I'm touring and interviewing. And I went, get the fuck out of my ICU. And she went, oh, and just shut it. And then I started cackling because, one, her face was priceless. And two, I was like, no, you're fine. Come on in here. I'll show you around.
Oh, I was ready to cut you. I was like,
Jesus. So
no ice cream.
No ice cream after dinner. But yeah, so that was Amber's introduction to me, was telling her to get the fuck out of my ICU. And I mean, she listened, but she does this thing where she will like blink really fast. And she was like trying to really hard not to like have words come out. And she was like, okay. Closed it. And then I was like, no, I'm just playing. Just come on in. And then she would randomly get text messages saying, come to the dark side. Because I pretty much told the manager, I was like, she's going to work internal medicine. She's not staying on emergency. Like, there was no ifs, ands, or buts. She's coming.
Come to the dark side text. When I was told I was going into IM, I was like, but I don't want to. I
said the same thing.
Because rounds every morning. I'm just going to throw it out there. Dr. Martin scared the bejesus out of me. I've never been so intimidated in my life by a doctor. Ever. This woman scared me to no end.
When I first met her, she had come for an interview. Like, she was touring the place, and she was like, well, I can't practice on this dog, but I can give you pointers. And she looked at me, and she was like, do you have blah, blah, blah? And I looked at her, and I was like, I don't even know what you said, so I'm going to go with no. Yeah. And she was like she's like, okay, do you have a blood pressure machine? And I went, yes. Off I go.
Yep, that I can get for you. That I can get.
Yeah.
But yeah, they're like, you're going to IM. No. And then I think drug to IM, kicking and screaming.
Kicking because she wasn't allowed to
The rest is
scream.
history. No, that was probably the best decision to continue to roll with that I've ever made in my career. Ever, 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 ever. I will never forget that time with you guys.
Yeah.
Learned so much and met so many incredible people.
Yeah. And it was fun. It was challenging, but then it turned to chaos. I left and ran away from Florida and moved into my brother's basement, where I still stay, like a little Harry Potter version, just under the cupboard. I'm thankful they took me in. Here I am, and here we are.
Yeah.
And
here we are.
Yeah, so we want to do big deep dives on topics people are afraid to talk about. If you haven't gathered, we're not. We will do it as politically correct as we can. We have been through it all. I've seen doctors throw things at technicians. I've seen phones and clipboards and clippers and all sorts of things thrown at technicians. I've seen clients call us all sorts of names. I've seen management turn on their staff, pit technician against technician, supervisor against supervisor, there's improvements to be made in the field. And if we can help guide that movement, that would be chef's kiss. We're not in it for the money in this field. We say we want to work with animals, but we end up only working with animals 25% of the time, and the rest is all human side of it. Yeah. So it's a interesting field to be in.
And I feel like the more, again, like you said, we don't get into this field for the money aspect. We get it because we genuinely have a love for animals, and we connect better with the animals than we do with people in a lot of instances. But I feel that compassion, that love, that advocacy, that natural, I have to speak for these animals, I have to be that person for them, that's where we get taken advantage of. Mm-hmm. And I feel like a lot of us allow ourselves to be treated any kind of way because that's what we're passionate about. Mm-hmm. Does that make sense?
Yeah.
If I didn't say that correctly, like you stay in a job for so long when you're mistreated because you love your patients, especially those ones, say like you're in GP or in your like specialty and you have those cancer patients or those chronic illnesses, that you have that bond with that animal and that family. You don't want to leave them regardless of how bad management and ownership treat you. Mm-hmm. How bad you feel like you're mentally battered every day, and the things that you've mentioned going through, because we don't want to leave our patients.
Yeah.
That's why we do what we do. It's part of our heart, it's part of our soul, and that gets taken advantage of on a daily.
Mm-hmm. Yeah. And it's also a good point to bring up is the team around you that helps support you through all of that. We've all had our deep, dark days. There was a day that I think, and it was Christmas time, and we did, on day shift, 18 euthanasias. I walked in with the euthanasia, and I walked out, and I couldn't, when the last one came, I looked at, because, the technician and I relieved each other on both shifts. I relieved her in the morning, she relieved me in the evening, and it ended with a 2-for-1 special pretty much because his Mastiff had osteosarc and the cat was renal failure. And I looked at her because I had a Mastiff at the time, and I just looked at her, I was like, I can't do it. And she was like, clock out, go home. She's like, I got this one. Yeah. And, that's what she told me in the morning. She's like, that's what I told her. That's what I told her in the morning is that, she was like, I can't do this one. And I was like, I got you. I was like, go away. I'm already clocked in. Yeah. I was like, go do what you need to do. So having that team, that support, both in and out.
And I feel like,
both in and out, you need it. And it's not just veterinary medicine. It's a whole lot of other careers. But this is the one we know deep down in our souls.
Yeah. I mean, we spend, 80% of our lives with each other. We spend more time with each other than we do our own families.
Yeah.
That support in and out of work is super important.
Yeah. Yeah. So that's, our goal for this podcast. We also want discussions with the people that follow us. What do you want to talk about? What do you want brought in for the table? And it's not necessarily just veterinary technicians, veterinarians. If the clients want a deep dive on a subject, we will do it. We'll bring in, doctors that will also help insight and make it layman's terms. Well, Amber and I will make it layman's terms for you to be able to fully understand a certain aspect of what you're dealing with. So yeah, that's WTV, What the Vet, where swearing will happen. I'm not sorry, it is me to a core. It is part of my vocabulary. Animal noises in the backgrounds will happen, and that's it's life. It's our life.
Yeah. It's real.
It's real.
It's raw. We're not hiding nothing. We're going to be upfront. We're going to be honest. And sometimes maybe a little too honest, a little transparent,
Yeah.
but
That
is what it
the
is.
best part is that I already have a plan for like when people leave hate comments. It's going to be a little segment called Yo Mama.
And when we want to get really professional about it, your mother.
When it's serious.
Where it's serious, it is your mother.
Your mother.
It's your
Yo
mother.
Mama. But yeah.
Everybody's going to have opinions.
Everybody's going to have opinions.
But-
We are going to ruffle feathers, but hopefully we ruffle more in a good way than a bad way.
Yeah.
So yeah, that's us. Thank you guys for following us, supporting us along the way.
Yes.
We'll have more things come
Very
up.
much appreciate it.
Like we plan on we plan on being Delulu about this with like merch and stuff like that. Like this is gonna be a big thing, guys. It's gonna be fine.
100%.
It's gonna be fine.
100%.
Don't be scared.
By the end of this, I want What the Vet fishing poles for my charter. Like done. You know what I mean? With a little emblem on them, What the Vet. You know,
And that
has nothing to do with fishing, but
and here's the thing. You know how that emblem's gonna get there? Stickers.
Yes. No, I want that on there, like custom rods, like custom What the Vet. That way, when somebody walks off with one, I know it's mine.
I mean, like, give me my rod back.
Right. Where did you get that, Bass Pro? The fuck you did. Give it to me.
Give it to me. It says WTV. What does that stand for?
Right.
What the Vet.
Flash my What the Vet tattoo. That's my logo.
Mine.
Yeah. Oh yeah, it's gonna be fun. It's gonna be a lot of fun.
It's gonna be fun. It's gonna be entertaining, and that is us in a nutshell. So thank you guys.
Yes.
Goodbye.
Thank you so much for watching and supporting, and hopefully we can make this something big to where everybody has a voice.
Exactly.
You know what I mean? In vet med that can bring issues forward that they're necessarily afraid to talk about or not comfortable, that we can voice for you.
Yeah.
Listen,
it takes a lot.
I'm to a point
I was gonna
right
say
now,
it takes a lot to, one, intimidate us because that's our personality, and two, to scare us. And it's not that we're going to be confrontational, like we're not. A little bit, but yeah, we want this to be something that will help.
Yeah. And the reason I got into practice management was advocacy, not just for my patients, but for the staff. I mean, from and not to say that, you're any less for any position, but from your kennel techs to your receptionists to your technicians to your assistants to the cleaning lady that comes in on the weekends to take care of the practice. Like, I will advocate for staff with the last breath that I have. And if it's something that you're afraid to talk about, or you need advice on how do I approach my boss with this, or how do I approach my coworker, or a corporate entity or something like that, as I have a problem, I have no issue. Granted, you could be anonymous, but I have no issue, and I'm sure Joyce is with me on that, is shedding light on the subject.
Yeah.
You know what I mean? Like, when it comes to advocacy for the staff, like, I have no filter. I'm professional about it, but I have no filter, and nothing will cause me to back down.
Yeah. And I can speak from that experience of her.
For when you... Right. But when Joyce was talking about, the mental things that you experience, and I went through the same thing because of a job, because of the things that I seen my staff go through, to where it got to a point to where I couldn't help them. And that sucked the life out of me because of the things that were occurring. And I brought that home with me every day because I couldn't fix it for them. I couldn't make it better. Yeah. So hopefully now with this platform, to be able to have some kind of influence to help guide people in the right direction, it might help me, but it also hopefully help quite a few others.
Yeah, exactly. So until next time, guys, we hope that this drops. It'll be in June, hopefully by the second or third week-ish. But yeah, more updates will be coming on the actual release date, on what would be like a good day of the week that it'll drop. It'll be Spotify, Apple, YouTube, all the above, and her cat is demanding the treats. I heard her.
She is. And I think because Tuesday is your favoriteest day of the week.
Fucking Tuesdays.
I know, fucking Tuesdays. We're putting that on a shirt.
No, you know what I have called Tuesdays at work? Throat Punch Tuesday.
Throat Punch Tuesday.
No, I lied. That's Thursday. Throat Punch Thursday.
That's Thursday. That's a Thursday.
Terrible Tuesday. Because it's terrible.
Yeah. What the fuck Wednesday? What the fuck's going to come through the door today?
Monday is Mournful Monday. Tuesday is Terrible Tuesday. Wednesday is Woeful Wednesday. Thursday's Throat Punch Thursday. And Friday is Fantastic Friday. I will give some joy to that because I don't work Saturdays or Sundays.
There you go. There you go.
All right, so we will end it here, guys, and more updates to come. So, yeah, drop a comment on what you would like to talk about, what you want brought to the table, and we'll do deep dives on it. It'll be fun for us, actually. Like,
yeah,
it will. It'll be fun for us.
Yeah, and please, just a disclaimer, please excuse my horrible sarcastic commentary on everything that we do every day in this field. So I'm just to that point.
It's who we are, and I think that brings our charm to another factor.
I question my mental stability, but it's okay.
All right, guys. Until next time. Bye. It's stopping. Okay. Something went wrong. Refresh the page and try again. Is it still recording?
It's still going. Yeah.
Listen, this isn't our first time. It's okay. It's fine. Can you stop it? Can you stop it on your end?
I can.
Please. We're just stop. I have it. The stop button is not it's not lit up, and there's not another way to stop it. So
It's broken.
we are not professionals, guys. Like we are not professionals. We are learning.
First time.
We are learning together.
Blue button. Okay.
Hold on.
Wait, hold on. Nope, can't do it. It's not clickable.
End session for all. Okay, that's what we're gonna do instead of stop recording. And then we'll circle back around, Amber. Welcome to WTV, guys.
Okay. Yes.
Is it ending?
No, we're going. I'm waiting for you. Are we like completely? I don't know what's happening right now. Are we?